It introduces new adult stem cells into damaged tissue to spur tissue transformation. This will repair, regenerate, and return damaged cells to their normal function. It is also seen as a potential cure to diseases ranging from osteoarthritis to diabetes, kidney, liver, and heart ailments. Stem cell treatment is also seen to help in the recovery of stroke victims. Let's find out more about stem cell therapy and treatment. I kind of still don't get it. Joining us this morning is an expert, Dr. Ricardo Quiñones. Dr. Quiñones, good morning and thanks for coming over.
Good morning, Pinky. Thank you very much for inviting me to ANC.
This is very interesting. Can you explain to me in layman's terms what is stem cell therapy?
It's very now popular. The adult stem cell therapy is being popular now because of its ability to regenerate, heal the properties of the stem cell. That's why it's being extensively researched because of their potential treatment for various diseases such as diabetes, osteoarthritis, stroke, and possibly they have potential for cure for these diseases.
But Doc, that means as we get older, our stem cells, is that correct? Our stem cells get damaged. Is that correct?
Yeah, in a sense. But as we grow old, the stem cell dramatically declined. When we were a child, we have this 80 million stem cells circulating in our body. And as we reach the age of 40, there's a dramatic decline to 35 million in circulating stem cells.
From 80?
From 80 million to 35 million.
So that's more than half of stem cells you actually lose.
Yeah. So by
Why does it die? I mean, what do you mean it dies? Your stem cell disappears?
Yes, it declines. It disappears.
Okay, so now you introduce new stem cells so that 35 million stem cells increases.
Yes.
Okay.
So by doing the adult adipose-derived stem cells, you're infusing back around 100 millions of stem cells to turn back the clock and do the repairing process.
Hindi ka naman ma-overdose kasi you start with about 85 million and then you put 100 million back?
No, hindi no.
There's
Actually,
no such thing.
Yeah, there's no such thing because the benefits also of the adipose-derived stem cell is that, especially for the anti-aging benefits.
I know, that's what they keep saying, babata daw yung itsura mo.
Yeah, exactly, yeah. I've done two patients from Zamboanga City, Chinese patients from Zamboanga City. And then I called them after the procedure and they said they look younger and they have this sense of physical activity.
Right.
They have this stamina, the vigor. They have this increase in short-term memory, powers of attention, and concentration.
Doc, I think you and I need to talk after the show.
All right.
No, but that's good. Short-term memory, it cures that. Ability to do sports. Wait a minute. What if, let's say, you've been injured? Can stem cell therapy repair that?
Yeah, it's very good for sports injuries, especially for knee. Yeah.
Yeah, because that's my problem. I have a knee problem.
Yeah, exactly. That's what you do. We inject PRP and stimulated activated stem cell into that part to regenerate the cartilage being damaged.
Okay, next question, Doc. If somebody does stem cell therapy, does it cure everything or do you go on a particular part of the body? For example, I have a knee injury and I have weak knees, for example, and I want it done. When you do stem cell therapy on me, is that the whole package? Will it cure everything else that's a problem for me?
Yes. Actually, what we're doing is we give 80% through the IV. The 80% of the activated stem cells are being infused to the patient, and 20% are being injected on that part that is being damaged.
Okay.
So
you can choose knee, arm, ganun po.
Yes, you can choose. But in my case, I treat the whole package. I do IV at the same time I inject those parts.
So what happens? Like you do? Is it an operation? Is it considered an operation?
No, it's just a simple 3-hour procedure. We're just gonna harvest around 100 to 200 ml of fats, and then we process it.
Fats?
Fats, yeah, from your own blood.
Really?
From the waste of the patient.
Okay, so how does it actually start? For example, you have a patient there. Oh, paano ho yung operation? A patient comes in. Does a person have to be a candidate for stem cell therapy, or is it possible that you cannot do stem cell therapy?
Yes, except for cancer, the stem cell is not being encouraged to manage cancer. But with other diseases, yes, Yes, we can do stem cells.
If you're a cancer patient, you survive cancer, can you do stem cell therapy?
Yes, as long as you are free from the cancer.
Okay, so how does it start? A patient goes to you, she or he is a candidate for stem cell therapy. What happens? Does she go to the OR, or is it just a clinic?
Yes, we got to have the clearance from their primary care physician. We run variety of laboratory tests. For the knee, we also have the MRI scan to document improvements after the stem cell therapy. And then, if everything is done, yes, we book the patient for appointment to do the stem cell.
Okay.
So, yeah.
What's the exact procedure once she's undergoing stem cell?
Once it's very easy. Like when everything is done, we just harvest 120 cc of fats.
How do you harvest? You inject what?
Well, we inject first. We same with liposuction. We infuse tumescent anesthesia to numb the area.
Okay.
And then we harvest by using the syringe technique. So it's a closed technique.
Okay.
And then we arrange around.
So you extract blood fat? Is that what it is?
We extract blood for PRP, and we also extract fats for fats.
And the person is awake while you're doing this?
Yes, I've done this to my patients. 4 of them are awake. 4 of them are awake.
Does it hurt?
No, it's not.
You don't feel it?
A little bit during the infusion of the anesthesia, but most of them are elderly people. Like the other one is 62 years old.
Opo.
The other one is 58. The other one is 67 years old. And the other one is 58 years old.
Okay.
Most of them are suffering from bad knees, osteoarthritis, and diabetes.
Okay, so you get a blood and
Fats
from the stomach.
Stomach, yes.
Okay. How long does that take?
It just take around 30 minutes to 1 hour to extract.
And then once that's extracted.
Once extracted, we centrifuge it to separate the fats and the stem cell.
Okay.
And then we activate it by the use of laser light and the patient's own PRP, the platelet-rich plasma, to activate the stem cell. And once activated, we infuse it back to the patient.
Through injection?
Through intravenous
IV.
IV, yeah.
Yeah, I see.
Yes.
How long is that IV going to take?
The IV is around 1 hour. So we have 80 drops per minute. So it takes 1 hour for them to stay there.
So more or less, you're just there for 3 hours?
3 to 4 hours.
Are you lying down, sitting down?
I have this setup that patients are lying down or they can sit while doing the infusion.
And once the patient is done with that, that's it. You're done, or you go for a second round?
Yeah, that's it.
Tapos
You just
na?
want. You just
3
need
hours?
once. Yeah, just 3 hours, and then that's it. You just wait for the stem cell to take effect. Some of them does improvement within 48 hours after the stem cell. Some of them several weeks to months. But according to research studies, they need to touch up, if they need a touch up, after 1 year.
Okay. So it depends on the person when you actually will see the benefits of stem cell therapy. It can take days, weeks, or months.
Yes.
As a doctor, you see your patient. Can you tell a patient through various tests if the stem cell therapy can work faster than other patients? No.
No.
Walang ganon.
Walang ganon.
So talagang wait and see.
Yes, you have to wait and see. But I asked them also, when I was doing my training for stem cell, I asked my trainer how about if the patient, said that there's no change, I felt no change
what
in my body. He emphatically told me that there's no such things.
Yeah.
Everybody report improvement.
Walang money back guarantee.
Yeah, it's precisely that's the one I asked question because of that money back guarantee.
Yeah.
But I've seen that. I've seen that when I do my mother-in-law. 24 hours after the procedure, she said that she doesn't have any sleep at all. She doesn't, for the past 30 years.
Yeah.
She doesn't have any good sleep. And then we were amazed that she told me the following day that this is the best sleep of her life.
Really?
Yeah. And then my wife, who is also a doctor, the one I did is her mother, told me that maybe she's just napagod lang yung mother ko. But eventually, she said that definitely that this is the first time in my life.
How does she look now?
I also did a PRP. Yeah, she looks rejuvenated. She looks more younger. She has more glow on her face.
Yeah?
Yes.
Skin is better, I hear. Your skin's going to be going to look so much better with stem cell therapy.
Exactly. Yes.
Yeah?
Yeah. Because of that, because stem cell therapy also increases your skin vitality, skin elasticity, thickness, and
Wow.
it also do good mood, sleeping patterns, good appetite, even eyesight and hearing.
Oh,
That's all the
it's a all cure for all. It seems like it.
It seems like, yeah. It seems like, yeah. It
Okay,
seems
Doc,
like,
so much upside. What's the downside?
well, yeah. Now it's the downside is there's only pain on the site when we get the harvest.
Yeah.
And I think, you know, the economics of the. I think that's the only downside.
Okay, how much is it? Let's go to that. How much is a 3-hour treatment of stem cell therapy? More or less, Doc.
It ranges between $8,000 to $15,000.
Can we go pesos? $8,000. That's about what? 4M? No, sorry.
No.
400.
Something like that,
400,000.
yeah, to 15, depending on the case of the patient. Yeah.
400,000. So $8,000 to $15,000.
$15,000.
So that's about what? 400,000 to I don't know. A million?
1 million, yeah.
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 It's more expensive abroad, isn't it? Much more.
It's much more, yeah. In Australia, which my technology came from, they charge $20,000 US. But in the Philippines, I just started
Yeah.
low.
Are you the only one doing this in the Philippines?
I'm the second one doing this one. There's already existing studies about diabetes in the Philippines. In that studies, there's a safety and efficacy of the adipose-derived autologous stem cell, and that's the safety of stem cell in the diabetes. In that studies, there's a decrease in fasting blood sugar, decrease in hemoglobin, and there's a safety of the treatment with diabetics. Yeah, but more recently, it's being used for COPD. The stem cell is now being used for COPD,
Which is
the idiopathic pulmonary fibrosis, which is being very common with the emphysema patient. Like they have this difficulty of frequent visit to hospital because of pneumonia.
Yeah.
Yes, they get this 10% lung capacity for their function. So yeah, it's being used now for COPD.
Doc, what's the best age to do stem cell therapy? Really?
The best, I cannot tell because they're also young adolescent who have this problem with difficulty of walking. They cannot go on with their life as a teenager or some of them go for that stem cell. So maybe according to, if we're going to base it to the data, well, around 40 years old, it's
You
best.
can do stem cell already
Yes.
at 40 years old?
40 years old, or even with those younger person with degenerative disorders.
Okay. But if you do it once, for example, Doc, and you want to do it again, say maybe after 10 years, will the effect be as good as the first time you did stem cell therapy?
Yes. At least it's
How do you know? Have you done it twice?
Not yet, but sooner or later, I'll do it on my patients also who's coming for the stem cell. Yes, I've also lots of inquiries about. Most of them are 75, 76, and the other one is 84 years old.
Is there a risk of death during a stem cell therapy procedure?
Yeah. When I heard this procedure, I was afraid about the risk of fat embolism because we're using the fats. But when I did the procedure, when I was trained to do the procedure, I specifically saw it in my eyes that there's no risk of fat embolism during the procedure.
What is that? What is fat embolism?
Fat embolism is like we do procedure like liposuction, and then the fats goes to your circulation. It leads to your lungs, and then that's the called fat embolism.
So it's fat going to places it shouldn't be going to.
Yes.
That's what it is.
Yes.
Where did you train for this?
I was trained by Australian trainer, come over to the Philippines and do the training in my clinic. Because they said that while going for abroad, you just observe patients doing it. If I go there to your clinic and I'll do one-on-one training with you, that's the best. That's more comprehensive than going for the convention.
How long did you train for?
I trained 4 or 5 patients to do the procedure. So they train me for the 5 patients should be done in your training, part of your training.
On-the-job training? Actual training
Actual
was
training,
actually
yes.
done.
Actual training, yes.
Yeah.
Yeah, it's very comprehensive training. Yeah, we provide you with all those, And of
Wait
course,
a minute. What kind of doctor is qualified to do stem cell therapy?
yeah, that's the question right now. That right now there are a lot of interest, like internists, plastic surgeons, others doctors can offer this to their clinic, but they have this. The only part that's being should have, because you do you do a little bit of liposuction procedure. So that's the thing that you should be also properly trained to do that procedure. Not just the technology, but when you should be equipped with liposuction procedure to do the stem cell therapy.
What kind of a doctor are you?
I trained for cosmetic surgery in the Pan Pacific Aesthetic Institute. I practice cosmetic surgery, and I also do dermatology at the PAPSP. And recently I have my certification to the American Academy of Aesthetic Medicine. And I will pursue, of course, anti-aging and regenerative medicine, because the stem cell lies under regenerative medicine.
That's
so
what it
I have
does.
to do another, yes.
Yeah.
Yeah. We have to do another course for the anti-aging and regenerative medicine.
Also, Doc, I wanted to go back to the cost. You said $8,000 to $15,000. Why would it depend on the patient? Sabi mo kasi it can range from $8,000 to $15,000. I'm assuming it depends on the patient or not.
Yes.
Why is there a
depends.
range of $8,000 to $15,000?
Easier cases, like simple cases, we just need a simple procedure to be done. Hard cases, hard cases, you do have to do the whole package of treatment. Sometimes for the simple procedure, you can just, like injection of the knee, doing the PRP, you just need a small kit. So if you're going to do the whole package, you need a big kit. So you do intravenous at the same time. At the same time, you do intra for the knee, you do intra-articular injection for that to work.
But the patient will know. Like when you examine a patient, the patient has to come to you and say, Doc, these are my problems.
Yes.
These are the improvements I want in my body,
Yes.
in my physical appearance. And from there on, you will be able to tell what exactly will be done and how much it's going to cost.
Yes, yes, I could tell, because when they book for an appointment, prior to seeing me, I instruct them to get those variety of laboratory tests. And then they said to me na naka-record na yung everything, the laboratory result, their history of like hypertension control, diabetes, osteoarthritis, everything should be there in the record of the patient.
I see.
And then when they come, I have already the idea what to do.
So the more problems you have, the more expensive it becomes. Diba? If you have more problems in your body.
Yes, that's the case. Yes.
Okay, does it treat asthma?
Yes, it's included in the literature. Asthma, it's very good for stem cell.
Really?
Yeah.
Does it treat vertigo?
Vertigo, no, it's not in the
Self-serving, Doc, that's all me.
vertigo. No, it's not mentioned in the literature.
Okay, so I can get a discount. What about there's a question, HIV patients. Does it benefit HIV patients?
Yes, there's ongoing clinical trials about the possibility to treat and possibly cure the HIV.
Non-conclusive.
Non-conclusive. Yeah, before I used to work with I used to inject people with before fillers, yeah.
Fillers here on that.
Yeah, I used to work with them.
Uh-huh.
So when I read that being possibly we can do to HIV patient. Before I'm doing it. Yeah, I'm doing it. Yeah.
Are you booked? Are you super booked? The truth.
No.
Hindi pa.
Hindi
Baka
pa.
pagkatapos nito.
Yeah, when it started when I was featured by the ABS-CBN.
TV Patrol.
TV
Yeah,
Patrol,
I saw that.
yes.
Yeah. Mm-hmm.
it started to, patients inquiring now.
Yeah?
Yeah.
Okay.
Yeah.
All right. So that stem cell therapy, for most of you or most of us who've been interested in this, what else do we need to know about stem cell therapy, Doc?
Well, you can. There are variety of. It's the medicine of the future. Like it's the future of medicine. Stem cell therapy is the future of medicine. Just keep updated. Just keep yourself updated. You can. There are lots of studies. You can, but also be careful to also look for certified,
Yeah.
because there are also inquiries about those people having stem cells, and they have this increased WBC count, and sometimes they go into coma.
Yeah. Okay.
Yeah, I've that text. One of my colleague texted me about that. But I told them what's the technology they're using. They said it's adipose-derived stem cell. With our technology, I've seen it in my eyes. Everything, the 5 patients I did, everything was fine. There's no complication whatever after the procedure.
When did you start, Doc?
I started last month putting up my.
Only
Yes.
then you've only had 5 patients since it's
Yes.
only been a month.
A month, yeah.
Uh-huh.
So, but I've been updated myself with the clinical trials. I've been attending conventions here and abroad.
Yeah.
So, the only thing I was able to set up the center is just last month.
Okay, let's talk about briefly, Doc. It can also help stroke victims.
Yes.
How?
They said that the stem cell being infused with stroke patient, it has the ability to regenerate and form new tissues to replace the damaged neural cells to heal. So it's being also used to as a cell to replace that old damage to the stroke patients.
Well, but brain damage? Yeah.
Yes,
Yeah.
yes.
How
yes.
about spinal cord injury?
It's being also dramatic result with spinal brain injury. It really works, especially for traumatic brain injury. In stem cell.
Heart damage.
Heart damage, yes. Heart damage.
All right. Yeah. It says how about missing teeth? What is that?
I think yes, because stem cell also is found also in the teeth of the person, the adult stem cell.
When implanted in the gums, it will give rise to a new tooth. All right, and expected to grow. All right,
Okay.
it's got a lot of upside here. Also blindness. Well, blindness, hindi naman siguro vision. What you said kanina earlier was
Yes,
kung medyo
increase,
malabo.
increase eyesight in hearing.
Wound healing.
It's very good for wound healing. I've seen it in my eyes. I'm also running a wound healing center. When combined with the stem cell, there's acceleration in the wound healing of the patient.
Infertility.
Yes, I have this patient. It's being mentioned that it works with infertility. I have a patient. I've done a patient with liposuction, and she's 39 years old, and she asked me about the possibility of stem cell doing the. She got this infantile uterus, small uterus, and when I do a research, I told her that yes, the infantile uterus is capable of supporting pregnancy, but I'm not really encouraging to, because it's not yet being clinically proven that it helps. But yes, I think she's willing to do the stem cell therapy for infertility.
Which hospital can they find you? Where are you located? Or you have your own clinic, Doc?
Yeah, I am in Santa Rosa, Laguna. I'm from the south. I've also affiliations with Santa Rosa Medical Center and the Ocampo Medical Center.
All right, Doc, thank you so much for explaining this to us. Let us know if there are any more developments on stem cell therapy. Again, the doctor says it's good at any age, as long as you can do a consultation with you first to find out if they actually really are. One last question before you go. If I was seriously thinking about it, what would you tell me? I mean, apart from the cost, let's say I had the money, I would probably rather go abroad because it seems that it's been practiced there longer than you. What can you tell me to encourage me or to make me feel comfortable that you're as good as the doctors abroad?
Yeah, I got this training. I got this actual patients of mine done. The same technology being offered abroad. is the same technology I have here in the Philippines. And I have also in my team, the one who trained me, who is also working with me, have 6 years experience to do it with me. So he's there since the inception of the technology in 2006, and then he's going to continue to work with me.
So this is not Filipino?
No, this is not Filipino.
Okay.
Yes. Yeah.
So he's working with you because since the inception of stem cell,
Yes.
he's been part of it or has been educated.
Yeah, he's the researcher. He is the one running the stem cell. So yeah, having him in my team, it's like giving the quality, which I saw during my training. That it's a quality-based training, and yeah, it really makes sense.
All right, he's Dr. Ricardo Quiñones, the second doctor who's doing stem cell therapy here in the Philippines. Again, Doc, thank you.
Thank you very much, Pinky.
Thank you.
Thank you.
Jason Kidd leads the Dallas Mavericks, so where is he moving? Let's find out when Paolo gives us the latest in the NBA and other sports stories when Mornings at ANC returns.